Mr. Jackson refused dinner after returning from work, and his wife wasn't happy about it because Mr. Jackson is diabetic.
My husband. I have told you, times without number, you need to stop certain lifestyles because of your health status. You are diabetic, for God's sake. You know you are on insulin support, yet you still consume alcoholic beverages heavily. When will you stop drinking beer? At least, for the sake of your health status. I always caution you about carbohydrates with high glycemic index. Instead of listening, for your own good, you eat outside where you can have whatever you so desire. Yet when you return, you start looking for your insulin dose. Why are you doing this to us?
As you can see, I am busy trying to conclude what I need to send to my clients tomorrow. Most I always eat at home. Who told you I ate any blood sugar spiking meal? Is it because I asked you to go get me my insulin dose? Please, let me have peace.
If you say so, I will be heading to bed. Don't stay up too late. Remember, you need at least 7 hours of sleep daily.
A year late, Mr. Jackson had a stroke and could not move about by himself anymore.
My husband. Do you see how you are suffering now? You can't move about by yourself. When I was cautioning you about your habits and diet because of your diabetic status, you refused to listen. Now see the consequence.
Honestly, I regret all my actions now. I know I am making you pass through so much pain and stress. Please forgive me.
I do not see any of this stress. Just that I am not happy seeing you suffering.
Honey.
My husband, what is happening? I am standing in front of you.
I can't see anything. What is happening? I can't see. I can't see. I can't see.
My husband, be calm. I will take you to the hospital immediately.
Mr. Jackson was rushed to the hospital immediately.
Mr. Jackson.
Dr. Brown.
Diabetes is not a death sentence. All you should have done is to live by the rules. Diabetes is a serious disorder, but when well controlled, through diet, lifestyle change, exercise and medication, diabetics can avoid the most debilitating conditions. It is important for people diagnosed with diabetes to take their condition seriously and change the lifestyle accordingly. Diabetes, if not managed, can lead to severe consequences such as 1. Blindness. High blood sugar can damage blood vessels in the eyes, which can cause diabetic retinopathy and eventually blindness. Diabetic retinopathy is the leading cause of blindness in adults over 30. Diabetes, if not managed, can also lead to glaucoma. The second consequence of untreated diabetes is nerve complications. Diabetes leads to nerve damage, especially in the hands and feet, which is why specialists recommend that diabetics examine their feet daily to check for ulcers or infections. Because, if not detected and treated early, it can lead to amputation. High blood sugar also leads to cognitive impairment, and in some cases, stroke. The third is heart disease. Cardiovascular disease is one of the major causes of death among diabetics. About 70% of diabetics have high blood pressure, which increases their risk of stroke. The fourth is kidney disease. Uncontrolled blood sugar also puts stress on the kidneys and can cause them to lose their ultrafiltration ability. Most kidney failure results due to uncontrolled diabetes. The following lifestyle changes are essential to control blood sugar, so as to avoid the consequences mentioned earlier. Patients with diabetes need to make sure they eat an adequate diet, rich in healthy protein and fiber, especially from whole grains, non-starchy vegetables, beans and many other legumes. They need to avoid processed carbohydrates and carbs with high glycemic index. Diabetics also need routine exercise to help burn some of the glucose in their blood. Thirdly, they need medication, but it must be based on prescription by a healthcare provider. Diabetics are at high risk of contracting hepatitis B and C due to regular puncturing during blood sugar test. This is why diabetics should be mindful of where and how they go about their regular blood sugar test. Follow my channel to see the next video, which will be on how diabetes exposes patients to hepatitis B and C due to frequent puncturing and ethics of test center. Thanks for watching. Please like, subscribe and turn on your notification bell to be notified when the next is dropped.